Music therapy and dementia. The research of themes related to music therapy and its potential benefits for those affected by dementia. We'll look at three studies: a meta analysis, a qualitative study, and a randomized control, their methods and outcomes, strengths and weaknesses, and then anything we can learn. So we'll start with a meta analysis. This looked at the musical intervention for patients with dementia. A meta-analysis is a statistical procedure for combining data from multiple studies. It allows you to identify common effects when treatment between studies is consistent and to identify variations when treatment is varied. There were 5 main dimensions that were broken up. First was active music therapy, which was defined as a combination of more than one musical therapy technique. Live versus recorded music, in which the music is either reproduced or played or sung by the therapist. The third was its selection, so whether or not it was up to the patient or done without consulting, purely left up to the music therapist and relatives. The fourth was intervention, and that refers to the social context in which the music was administered. And finally, music types. So this was defined broadly as classical and relaxation versus pop or native. There were also 4 method effects that are defined further on. So they used a broad search strategy. There's a multiple list there of some websites, including Medline, Cochrane Library, ProQuest. They used the same keyword combinations throughout, so music and dementia or music and Alzheimer. They also adhered to a strict selection and eligibility criteria. So this was only published articles considered. Some primary studies that only summarized and foreign language studies all had to be excluded. Anything listing active music therapy, receptive music therapy, and music listening as a method was eligible. The sample size had to be over 10. And to include sufferers of dementia, they must have a clinical diagnosis according to either the Mini Mental State Examination, the GBS rating scale, or the National Institute of Neurological and Communication Disorders. After all of this, only 90 articles were yielded, with 19 being included after all the criteria was met. So the outcome measures, there were 4. Affective outcomes included the geriatric depression scale, the rating anxiety and dementia scale, and the state trait anxiety inventory, as well as the real-time multiple event recorder. So these were used to evaluate the well-being of the patient. Behavioural outcomes included the multidimensional observational scale for elderly subjects, which was used to evaluate behaviour in older patients. The Cohen-Mansfield agitation inventory that captures behaviours that are related to the underlying conceptualization of agitation, an agitation checklist, a behavioural chart list, and the neuropsychiatric inventory were all used to measure the behavioural disturbances. Thirdly, cognitive outcomes included the Western Aphasia Battery, and that helped to evaluate language abilities. And then finally, physiological measures, which included heart rate, breathing rate, and blood pressure. So here's an example of one of the tables used within the meta-analysis listing the outcomes of the musical interventions. So the results, they used mean effect sizes that were computed for all of the results. In the end, it confirmed most previous research involving dementia and music therapy. Cognitive outcomes appeared to be most effective. Despite only 4 studies specifically addressing cognition, it indicated a large and significant effect. Physiological outcomes were also most improved, and again, only 4 studies were connected with this theme, but they showed large homogeneous mean effect sizes. Affective outcomes were not improved. However, it was noted that this result is contradictory to evidence in literature at present, and a reasoning for this may have been because of the small sample sizes that were used in many of the studies. And finally, behavioural outcomes. They were high and affected, but not overly significant. This confirmed results of therapy practice and previous meta-analysis that have been conducted. So overall, musical interventions were seen to be effective for patients suffering with dementia. Our second study was qualitative. So this is primarily exploratory, looking at people's lives, experiences, and behaviours. So this was titled What Carers and Families Said About Music Therapy on Behaviours of Older People with Dementia. Their focus was on group music therapy and dementia and their behaviours, as well as evaluating on both of those things. and it was from the perspective of family members and its staff, which I found to be really interesting. Their methods, they used semi-structured focus groups and conducted interviews. So 23 care staff were broken into 3 focus groups, 7 family members were broken into 2 focus groups, and reflections were made after a 12-week period of group music therapy had been completed on the residents of the aged care facility. So an experienced interviewer and qualitative researcher titled AT was used to conduct all of the interviews. AT kept a thematic log as a data source, as well as theoretical notes that were recorded at the conclusion of each of the interviews. 20 to 44 minutes in length, these interviews were, and they were digitally recorded and transcribed, and a qualitative content analysis was used to identify the core themes, which are as follows. So the study was listed and broken down into quotations, but the 3 main themes we saw were temporality, which dealt with the stage of the dementia and the family's perception of the illness; effect, which was the perceived outcomes and its overall value; and then finally policy. Policy was a really important one because both carers and family members acknowledged that it's a good thing and it was prized and worthwhile, but they also, especially the care providers, wanted the policymakers to know that planning, funding, and timing of music therapy needed consideration. The effect looked at the influence of the therapist, but they did note that it's a diversion and not only an instrumental in value, but good for socialization and an activity, bringing groups of people together. Furthermore, both the carers and family members noted that the personal characteristics of the music therapists themselves was very important. So the overall conclusions of this study was the timing of the music therapy was quite important, that it had a temporal effect of being in the moment for all of the residents. A common theme of music versus music therapists came up, and that it could be a misunderstanding between the benefits of having a trained music therapist versus just using recorded music. The interpersonal influence of the music therapist with both the staff, family, and residents, as well as noting that it did provide happiness and a social enjoyment. So our final study was a randomized control trial. So this is allocated at random by chance alone, allowing people to receive one of several clinical interventions. So this control trial was titled The Impact of Group Music Therapy on Depression and Cognition in Elderly Persons with Dementia. So they focused on quality of life, specifically anxiety and depression reduction in a group music therapy setting. So this method also used a strict criteria for inclusion. They had to be over the age of 65 years, living in a nursing home with no hearing impairment, diagnosed with dementia by the on-site physician. They couldn't be participating in any other research. They had to have no receptive language problems, willing and able to participate in 30 minutes of the intervention, as well as providing a written consent. So after they had adhered to that criteria, they were randomly assigned to either the sample group or the experimental group. Both groups would receive care as usual. The experimental group would also receive 30-minute sessions of group music therapy twice weekly for 6 weeks. The time of the sessions and the days of the week that they occurred remained constant throughout the study. Here is an example, a table of the methodology. Furthermore, they looked at demographics, so they considered gender, the marital status, the education, age, disease characteristics. An interest in music evaluation form was completed by the music therapist before the commencement of the study. The Scale of Depression, or CCSDD, which is a Chinese version of the Cornell Scale for Depression and Dementia, was used to assess the effects of the musical intervention. The saliva cortisol measure was used as a biological marker of changes in depression level and in response to the intervention by measuring the hormone concentration within the saliva. And then finally, the mini mental state examination. A Chinese version of this was used to assess cognitive function. Here is an example of one of the tables of the results. So the experimental group, according to the CSDD, had a downward trend, with the sample group showing no change or no trend at all, so the usual care was just maintained. These results were analysed using statistical package for the social sciences, inferential statistics by GEE, and AEs, or adverse events. They were analysed using descriptive statistics. There were also noted that no significant differences in the participant statistics between the groups was seen. So the salivatory cortisol values also showed no significant change, and that despite positive impacts of music that was noted. The GEE supported the hypothesis that the effects were apparent even up to a month later, and the MMSE mean values trended upwards, specifically with mild to moderate dementia being improved. So in conclusion, they noted that group music therapy can decrease depression, delay cognitive deterioration, and noted that it was more appropriate for mild to moderate dementia versus severe. So now we'll look at all three of the studies and some of the strengths and weaknesses of each. The meta-analysis had very good pre and post consideration for all of the data within each of the studies. It was very well structured, detailed, and well described when they listed their selection criteria. The overall outcome of the study also provided an up-to-date review of literature within this field. Some of the weaknesses, however, a lot of the research showed to have only small sample sizes, and perhaps the selection criteria was so limiting that it disallowed a lot of papers to be included. The qualitative research I found to be a great way to include some otherwise forgotten information, such as details seen and observed by family members and carers. It was a great way to include reflections from different perspectives, again, such as what the family member can see and witness in their loved ones, and highlighted some great differences. Weaknesses: the overall study itself was quite scattered in its presentation of the data. A lot of the data was just quotes and long logs of conversation. It was kind of difficult to draw out the data. Furthermore, they also had quite small group sizes, especially within the family members. The randomized control trial, obviously the beauty of the randomization allowed for legitimate, definite randomized control results. They also adhered to strict selection criteria, maintaining their core methods and themes throughout. However, some of the weaknesses, they did note that it was a very short treatment period, only 6 weeks worth of music therapy, and that they lacked a follow-up of any of the benefits of music therapy on the patients thereafter. So what can we learn from this? Overall, these three studies did show that group music therapy had benefits and was very appropriate for use with patients suffering from dementia. Larger sample sizes for studies was a common theme throughout all of the research as well. If we continue to research in this area, it will improve methodological quality and expand the research limits of the papers, and all of them noted to think to the future for what music therapy could provide for patients suffering from late stages of dementia. Here are the references, and thank you very much.